Hello guys, welcome to the Whiteboard Doc. If you haven't watched the lectures on the nephrotic syndrome basics as well as the treatment of the first episode, kindly watch them and come to this. In this lecture, we'll look at the complications of nephrotic syndrome. So the first complication we'll be discussing is edema. We know that the patient of the nephrotic syndrome will have edema either in the periorbital region, lower limbs or in the sacral region. All the patient can have anasarca, that is generalized body edema. If the patient has edema, we'll advise for salt restriction. So the first thing that we'll ask the patient to do is salt restriction. Along with that, we can also start oral diuretics such as oral hydrochlorothiazide. Oral hydrochlorothiazide, or we can also give oral furosemide tablets. Oral furosemide tablets for a few days. Remember, if the patient has massive edema, we will go for higher amount of furosemide. Along with that, we can give spironolactone as well. If the patient has massive edema, then we'll go for higher amount of furosemide. Along with that, we will also give spironolactone. And what is the indication of albumin infusion? Indication of albumin infusion in patients suffering with nephrotic syndrome. So first we'll try these things, and when the serum albumin levels are too low causing poor renal perfusion, then we'll go for albumin infusion. That is when serum albumin levels are low enough causing poor renal perfusion. Or you can say oliguria as well. So because of low serum albumin, if the patient is having poor renal perfusion or oliguria, that is when we need to decide for albumin infusion. So the second complication that we are discussing is the patient can have infections. Why infections? Because the patient is losing immunoglobulins through the urine. This infection is commonly due to, so the common causes will be streptococcus pneumonia, as well as some of the gram-negative organisms can also cause the infections, as well as varicella as well. So for varicella, we'll usually give acyclovir for 7 days. Some of the serious infections that the patient of nephrotic syndrome can have are the patient can have peritonitis. If the patient has peritonitis, he will present with low-grade fever, as well as the patient will have diarrhea. Along with it, abdominal discomfort as well. Okay. Then the patient can also have cellulitis. This might result in the form of anterior abdominal wall edema. The patient can suffer from pneumonia as well as the patient can have meningitis as well. So from small infections to some serious infections, the patient of nephrotic syndrome can suffer. So the patient suffering from nephrotic syndrome, we will usually advise him for immunization with pneumococcal as well as varicella vaccines. This is done when once the patient is of the steroid for up to 4 weeks. That's when we'll advise the patient to undergo immunization. So this is the second complication, the infections. The third complication we will be discussing here, thrombotic complications. So the patient suffering from nephrotic syndrome, they generally have a hypercoagulable state in the blood. Because of this, the patient can have renal vein or artery thrombosis. The patient can have pulmonary vein or artery thrombosis. As well as the patient can have cerebral venous thrombosis, resulting into stroke and other complications. These mainly thrombotic complications are due to the patient is using diuretics. Diuretics leads to hypovolemia and triggers the hypercoagulable state. It can also be due to venipuncture of deep veins during any procedure. And the major cause will be due to hypovolemia. And if the patient has any thrombotic complications, or to prevent it, we'll usually manage with the low molecular weight heparin. Low molecular weight heparin. Followed by, we can switch the patient on oral anticoagulants as well. So this will be the third complication and its management. Moving on to the fourth complication of a patient suffering from nephrotic syndrome is steroid toxicity. So as I just told you, the management of the nephrotic syndrome is steroids. So if you give excess steroids, the patient will have steroid toxicity, leading to Cushingoid features. The Cushingoid features are just the increased abdominal fat, buffalo hump, and then the skin streaks that are seen below the abdomen. The patient can have short stature if the patient is pediatric age group. Patient can have hypertension as well as the resulting osteoporosis because of excess steroids. So these are the complications because of steroid toxicity. The fifth complication you'll be learning is hypovolemia. As well as a patient can also have acute renal failure. Patient can go into ARF. Generally, this hypovolemia is due to poor oral intake. Then it may also be because of the diarrhea as well as vomiting. And generally, the clinical features of patients suffering from ARF as well as hypovolemia is abdominal pain, then the patient can have lethargy, dizziness, leg cramps. Patient can have tachycardia from the resulting hypovolemia. Patient can present with hypotension, delayed capillary refill time. Patient can have low volume pulse as well as clammy and cold distal extremities. So these are all the clinical features if the patient has hypovolemia as well as acute renal failure. And what are all the blood indications that suggest hypovolemia? So blood indications that suggest hypovolemia are: number 1, elevated blood urea bar create ratio. Elevated blood urea bar creatinine ratio, and also it is because when we see increased hematocrit in the patient, or if the patient's urine sodium levels are less than 20 milliequivalents per liter, or if the patient's urine potassium index calculated as urine potassium divided by urine potassium plus urine sodium, and this is more than 0.6. These are all the blood parameters that indicate the patient is having hypovolemia. What we'll do if the patient has hypovolemia? Immediate management for this will be rapid NS infusion. Up to 10 to 20 ml per kg over the next 20 to 30 minutes. If the patient has no response, then we'll go for 5% albumin infusion. Usually we'll start with 5% albumin infusion for up to 10 to 15 ml per kg, or we can switch to 20% albumin infusion, and this we can give up to 0.5 to 1 gram per kg. So yes guys, this will be the complications of nephrotic syndrome and its management as well. If you like my lecture, kindly do share and subscribe as well. Share this lecture to other friends if you find this helpful. Thank you guys. Thank you for watching.